In today's video, we will be discussing the proper process of removal of sutures. What this practicum is the proper way to remove sutures following a surgery. And this is usually done anywhere from 7 to 14 days after surgery, depending on what specific procedure was done and where that animal was operated on. Not all sutures are absorbable, so removal of the sutures is necessary for the final healing process of that animal and their wound. And this also allows the veterinarian an opportunity to inspect that specific surgery site to make sure it has healed properly. A vet assistant or a vet technician in a vet clinic can properly remove the sutures post-op. Step 1 is to clearly visualize and inspect the incision site. Some common signs that there is something wrong with this incision site would be abnormal amounts of heat, redness, swelling, pus, and any foul smell. Step 2, if there is a problem, as was mentioned with the incision site, you will want to inform the veterinarian at this time. Step 3, if there are no problems, you may remove the sutures. To do this, you're going to want to utilize the proper tools. So for step 4, you will want to select lid-hour scissors, which are a form of suture removal scissors, and they have a small hook in one end of the scissor that will help you easily get under that suture material and hold it while you cut. A staple remover would be used to remove staples. Rat tooth forceps are a type of a forceps that can help you in handling that suture material, so that way you can steady that material while you are using the lid-hour scissors to properly cut the sutures. Step 5, you'll place the curved blade of the lid-hour scissors underneath the suture for removal, and then remove those sutures. Step 6 is to not cause any unnecessary harm or discomfort to the patient. It is very common after removal of sutures for there to be some slight redness or even possible minimal bleeding, but if there seems to be anything more than that or anything out of the ordinary, you will want to make sure that you inform the veterinarian immediately.
Hi, my name is Courtney Jones. I'm a registered veterinary technician, and today I'll be properly demonstrating how to remove sutures. About anyone in a veterinary hospital can remove the sutures. It's just a matter of having the veterinarian examine this incision beforehand. Most of the time the veterinary technician can thoroughly examine the incision to ensure that the sutures are ready to be removed. However, it is very important that we do have the veterinarian look at it as well. We want to make sure that we're removing the sutures about 10 to 14 days after the sutures were placed. That gives a proper healing time so we don't have any complications. And when we look at our incision, we want to make sure that it's properly healed, it's not open anywhere, there's no discharge, and it's not red or inflamed. If we notice that the incision has healed perfectly, we don't have any complications, and the veterinarian has approved that we can go ahead and remove these sutures, then we will start. So here I do have a few different types of materials. I have my staple removal, which we won't be using today since we're removing stitches, not staples. And then I have two types of lid-hour suture removal scissors. I have a smaller pair. This is going to be used more for something more delicate around the eye or a lot smaller suture. And then I have a bigger pair here that we will use for today. And then I always have an extra pair of forceps, and today I'll be using my Brown Atson forceps to help lift up those sutures to easily remove. So to start, I'll make sure I have the curved portion of my lid-hour suture removal scissors pointed down to almost scoop under those sutures to remove. When I'm ready, I'll go ahead and take my forceps and grab one of the tail ends of the suture. And like I said, I'll have this scoop portion to go under that suture material, and I'm going to make sure I don't have any skin or other material that I will be cutting. Once I ensure that, I'll go ahead and cut and remove that suture. And I will continue until all the sutures have been removed. We can always always expect a little bit of bleeding with a suture removal or a little bit of redness afterwards. Excessive bleeding and extreme inflammation is not common, and that should be reported to the veterinarian. And if there are any scabs around that, we want to make sure that we don't pick those. Just like with us, if we have a scab on a wound, we're not going to pick that because it's going to prolong the healing process. So once we've removed the stitches and we have then confirmed before and after that our incision has looked good, then we will go ahead and send away the pet, and he has been very good today. I'm going to properly demonstrate how to remove sutures. I'm going to properly visualize and inspect the incision site. If there are no problems with the incision site, I will inform the veterinarian, and if there are no problems, then I will remove the sutures. I will choose the correct tool to remove the sutures. I will place the curved blade underneath the suture for removal and remove the suture. I ensured that I did not cause any unnecessary harm or discomfort to the patient.
In summary, to properly remove sutures, you want to clearly visualize and inspect the incision site. If there are problems with the incision site, inform the veterinarian, and if there aren't any problems, go ahead and remove the sutures. Choose the correct tool to remove the sutures. Place the curved blade underneath the suture for removal and remove the sutures, and do not cause any unnecessary harm or discomfort to the patient during this procedure.